Bacillary dysentery. It is almost synonymous with shigellosis because Shigella dysentery type 1A, Shigella body flexneri and your sonni, these four Shigella subtypes is responsible for the very high amount of blood in stool. The blood must be visible macroscopically and microscopically more than 5 RBC in the stool. And infancy it is less common, but when it does occur, it is in severe form, high case fatality than any age else. Mind it, 10% of the Shigella may not have blood in stool. They have diarrhea-like presentation. So it is more common in below 10 years age group in children, and your endemic zone has asymptomatic carriers. So it's warm weather in the west and in the tropical climates like us. It is more common in the rainy season, and your fever can be there. Persistent diarrhea can be an accompaniment, and septicemia, toxemia can be there. Rectal prolapse, toxic perforation, dilatation, the intestinal complications are quite possible, and perforation is also possible. And your post Shigella or post-infection syndrome, hemolytic uremic syndrome by Shigella dysentery type 1A, and it's also possible with the enterohemorrhagic E. coli 0157H7. It is also possible to have this sort of outcome, and IBS is possible, and severe sort of cachexia, protein energy malnutrition is also possible. So and then your extraintestinal complications like reactive arthritis is also possible. So how to treat, how to diagnose basically? Diagnosis is by the stolari, the invasive pictures, RBC, macrophage and pasture, and stool culture in appropriate media, in the exclusion of the other differentials, other organisms that cause this sort of invasive diarrhea like Clostridium perfringens, the Clostridium difficile, and the Enterohistolitica, yes, and enterohemorrhagic E. coli, and few more. So they are to be taken into consideration. Even this sort of invasive diarrhea can have meningitis, encephalitic-like features, even with CSF changes. So it's quite wide spectrum of disease, and your Clostridium difficile, non-typhoid salmonella, they also can cause this sort of presentation, but they are less common. So treatment is by an antibiotic. The current sensitivity, yes, it is the oral form. It is cefixime, azithromycin, ciprofloxacin. If you do not have desired response, you may have ceftriaxone. So for 5 days or something, and your nutritional care, ORS, zinc, vitamin A, they reduce the mortality and morbidity.